Hello students, hope you all are fine and have started your studies. So expecting that you have completed your last worksheet, today let's begin with your chapter 2 of Social and Political Life book, which is Role of the Government in Health. Now before starting this chapter, let's recall that in the last chapter I have told you that we all are politically equal. That means we all have voting rights according to Universal Adult Franchise of the Indian Constitution. Right? So, if we vote and choose our government, obviously we expect from our government that they will work for us. That's what people expect from our government, that our government will work for the welfare of the people. Now, how will these governments work for the welfare of the people? By improving the conditions of education, health, electricity, development of roads, your generating employment, etc. By these ways, our government can think of the welfare of the citizens of the India, right? Now, today in this chapter, we will focus that how government plays role in health, how this government work for the health of the citizens. Now, if we are discussing that how government work for the welfare of the people especially relating to health, we should first know what is health. So if I ask you this question, what is health? You'll say, if I'm able to go to school, I am healthy. If I am able to play, that means I am healthy. Or you might say that if I am free from illness, free from any kind of disease or injuries, I am healthy. Yes, this is correct. But health does not confine to this much only. It has various other factors. And to understand these factors, let me recall Kanta's stories, in which Kanta had, while talking to her friend Sujata, she said that her daughter usually falls sick because of unhygienic environment in which they are living. Right? That means environment somewhere plays important role in keeping us healthy. In the same way, there are so many diseases which are caused because of drinking unsafe water. That means waterborne diseases exist. So, safe drinking water is also required to keep us healthy. In the same way, adequate, proper diet is required to keep us healthy. So, these are various other factors which are also included if we talk about health. And if we are talking about health and role of government in providing good health to our citizens, that means government has to focus on these two parameters. That means government has to look after the prevention of the disease as well as the treatment of the disease. How? If government is providing us good environment, safe drinking water, nutritious food, that means government is providing us prevention from any kind of disease. And if in case still we fall ill, there is provision of treatment of the disease. So if we are talking about role of the government in health, we are talking about all these aspects of the health. So now that it is clear that government has to focus on prevention and treatment of the illness, now we need to understand for these two things we need proper healthcare facilities. Now what are proper healthcare facilities? Proper healthcare facilities includes your hospitals, your healthcare centers and your laboratories. Now if we have to go for a test, say your blood test, we need to take blood sample and this sample goes to a lab where it is tested and your disease is diagnosed. This is why laboratories are also required as proper healthcare facilities. In the same way, if someone meets an accident, we immediately call ambulance. So ambulance is also included in proper healthcare facilities. Whereas if someone is having shortage of blood and particular kind of blood group is required, we immediately contact blood banks. So proper blood bank facilities also required. So these are proper healthcare facilities, and to run these facilities we need proper healthcare workers like our doctors, nurses, proper health professionals, etc. And with these, we need medicines and medical equipments to treat people. So these are proper healthcare facilities, and on the basis of these, now we will study about the conditions of healthcare in India. And to better understand the condition of healthcare in India, we have to focus on a chart which is given in your book. Now you can see the chart which is there in your book, and this chart is divided into two main columns. In first column, which is this one, we can see that India is rapidly growing in healthcare facilities, and in the other column we can see that still we are lacking in providing these health facilities to everyone, every citizen of the country. Now let's see to the first point, which says that India has the largest number of medical colleges, which means that more number of medical colleges means more number of doctors. That means we have many doctors in our country, but these doctors are mostly settled in urban areas. Now again, problems there. If doctors are settled in urban areas, what about the people living in the rural areas? They again have to travel long distance to reach a doctor. That means we are not able to provide doctor to every person who are living in the rural areas. Moving on to the second point, healthcare facilities have grown substantially. That means we talked about healthcare facilities, which are ambulance, your doctors, your nurses, your hospitals. We are growing in this field. Now, still, if we see on the other hand, still people are not getting better treatment. They are still dying from diseases like tuberculosis, diarrhea and malaria. So we can say we are not able to provide these healthcare facilities properly to everyone living in our country. Moving on to the third point, which says India gets a large number of medical tourists. Now we need to understand this thing. What are medical tourists? Who are medical tourists? Now, medical tourists are people who come from different countries to our country to get their treatment. Now, these people come to those hospitals which are considered best in the world, and they get their treatment in our country. Whereas if we move on to the second column, which says that we in India are not able to provide clean drinking water to the citizens of India. Now, on the first hand, we are saying that people from outside are getting treatment in our country, but on the other side, citizens of India are not able to get clean, safe drinking water, and due to which there are waterborne diseases like diarrhea, worms, hepatitis. Moving on to the fourth point, which says India is the third largest producer of medicines in the world. That means we are producing lots and lots of medicines, but we are not able to provide adequate food to our people who are living in India, to the citizens or to the children of India. They are malnutritious or undernourished. So this chart says that on one hand, India is rapidly growing in healthcare, but on the other hand, we are not able to provide this healthcare to everyone, every citizen living in the country proportionately. To understand healthcare services in India, let's begin with the story of Hakim Sheikh. Hakim Sheikh is an agricultural laborer in West Bengal. He is also a member of Paschim Banga Khet Mazdoor Samiti. Now this Paschim Banga Khet Mazdoor Samiti is an organization who used to work for the betterment of agricultural laborers in West Bengal. On one fine evening, Hakim Sheikh was travelling from one place to another and he met an accident. In this accident, he fell off from a running train. Obviously, it caused him numerous head injuries, and as someone meets an accident, people around him takes him to the hospital. In the same way, people around Hakim Sheikh took him to a government hospital, where he was refused to be admitted because there were no spare beds, and people were asked to take him to another hospital. Now people took him to second hospital. It was again a government hospital, and there also Hakim Sheikh was refused to be admitted because there were no specialized doctors. So, like this, people took Hakim Sheikh to 8 different government hospitals where he was refused to be admitted. In this critical state, he spent 14 hours, and then people took him to a private hospital where he was immediately admitted. But it cost huge amount of money to him. He soon got well, but he was very angry on the behavior of the government hospital. So he decided to file a case against government hospitals with the help of Paschim Banga Khed Mazdoor Samiti. Now you might be thinking, on what basis will Hakim Sheikh file a case against government hospitals, and what court will decide? Now it is very important to understand that court took its decision on the basis of Indian Constitution and Article 21, which states that right to life of every person. Now Hakim Sheikh was denied of this right, and this denial could have cost him of his life. So court decided that government will now pay him all his expenses which he spent on his treatment as compensation. Further, court states that it was the duty of the government to provide healthcare services to everyone. Now children, think, how will government provide these healthcare services to everyone? Now see, we are so many in population. How will government do this? This is done in 2 ways. One, public health services, and the other one is private health services. We'll take it one by one. Public health services is a chain of hospitals run by government. That means all the expenses of the hospitals are taken care by government. So, government makes sure that everyone who is living in this country gets these public health services, and to provide these health services, it has started primary health centers at village. Look here, at village we have primary health centers. At district we have district hospitals, and at big cities we have large hospitals like government hospitals. Like in Lucknow we have government hospital. Through these hospitals, government makes sure that everyone get health services. Okay, if I ask you one simple question, why are these health services known as public healthcare services? So you will say, ma'am, because these healthcare services provide services to public, that is why it is known as public health care services, right? But with this, these healthcare services are because of the public money. How? In class 6th, you remember, you read what is tax and who pays taxes. We the people pay taxes, and government use these tax to provide healthcare services to everyone. So indirectly, these services are provided by public money. So we can say it as public health services. Now, with this, government makes sure that everyone, whether rich or poor, get these services. And for poor, it is there that either at low cost or for free, they'll get these services. Now, government makes sure that during the time of emergency also, like there was spread of dengue and there was spread of malaria, during that time also government provided these healthcare services to everyone. Take the current example of coronavirus. Now, this virus is spread everywhere and everyone is getting treatment by government in the government hospitals. Does government charge for these treatment? No. It makes sure that everyone gets the treatment and it is provided to them for free. So it is the duty of the government to provide healthcare services to everyone, and this is done through public health services. Now let's talk about private healthcare services. These healthcare services are also a chain of hospitals which are not run by governments. As the name suggests, they are run by private individual or by group of individuals or some private company. Like we have Apollo Hospital, we have Mac Hospital, these are private hospitals. Now, if you remember, I told you that doctors mostly prefer to settle down in urban areas. What they do, they either own their clinic, private clinic or private hospital. And in these private hospitals, we have Ambulance services. With ambulance services, we have privately owned medical stores, we have private blood banks, we have private laboratories. So these services which are privately owned, they are known as private healthcare services. Though these private healthcare services or private hospitals provide best services, but they are too expensive and mostly concentrated in urban areas. Now that we have understood what are public healthcare services and what are private healthcare services, I want to ask you, are these healthcare services available to all? Now let's discuss this. We all know the conditions of public healthcare systems that are government hospitals. They're not that developed in comparison to private healthcare services or private hospitals. As well as private hospitals are more in number in comparison to government hospitals. But these private hospitals are mainly concentrated in urban areas. What about the people living in the rural areas? These services are not available to them. If they want these services, they have to travel a long distance again. Whereas these private hospitals are too expensive, so it is not possible for poor people to afford it. As well as doctors in private hospitals generally write costly medicines. Though they have alternatives of cheaper medicines, but they intentionally writes costly medicines in their medication. Again, poor people, how will they afford it? That means they are not available for poor people. If you see the data, you will come to know that only 20% of the population can afford these private healthcare services. To the families who have to bear these expenses of private hospitals, it brings more and more hardship for their family, because if they have to afford it, they have to either sell their property or they have to take loan from money lenders. And you know, children, these poor people are more prone to illness. Why? Because they are the one who live in unhygienic environment, unclean environment. They are the ones who have to take unsafe water, and they are the ones who are more undernourished. So who is more prone to illness? These poor people are more prone to illness, and if one of the family member of these poor family gets ill, it brings, the situation becomes more worse. What can be done in this situation? What can our government do to provide basic necessities like safe and clean environment, safe drinking water, and proper diet, especially to these poor people, so that they can be more healthy? There are two examples which are landmark in this field. Let's discuss first example, which is the Kerala experience. Now this Kerala is a small state in India itself. Let's have a look on Indian map today. Now you all can see the map, and Kerala is in South India. It is this small part. This is Kerala state. Now in 1996, the Kerala state government decided that 40% of its state budget will be given to the village panchayats. Now state budget is a financial statement of expenses of the state, out of which 40% will be given to the village panchayat. And you know, village panchayat, you have read about village panchayat in class 6th, that these panchayats work for the welfare of the people. And this money was given to the village panchayat, and they were the authority to decide how they want to spend this money for the welfare of the village people. This was done, and clear development can be seen in the villages. There was improvement in the water supply, food supply, as well as education was improved. Anganwadis were ensured with good facilities. But despite of these efforts of the state government, still lots of improvement is required in the villages. After the Kerala experience, let's discuss our second example, which is the Costa Rican approach. Now this Costa Rica is a small country in Central America. Let's have a look on world map. Now this is your world map, and you can see this is North America and this is South America. Costa Rica is in Central America. This small country is Costa Rica. Now, Costa Rica is considered as one of the healthiest country in Central America because the government of Costa Rica several years ago decided to spend more on the welfare of the people. So what they decided to not to keep army and to spend the army budget in the welfare of the people, especially taking care of the health of the people, and today they are considered as one of the healthiest country in Central America. So this was Costa Rican approach in which they considered health most important. In the same way, Indian government is also trying to bring improvement in the healthcare services, and this was your chapter, Role of the Government in